This is the Dengie Medical Partnership Bulletin for July 2020. It's been quite a journey over the last few months for everyone, and we're very grateful to our team of staff and patients for pulling together over this time. We're now in the process of working out what the new normal is going to look like for us, and in this video you will find the following sections. Firstly, what's the surgery now doing, and what are we still not doing? Secondly, what's changed when people visit the surgery premises? Thirdly, some news, happily, thankfully, of the GP Patient Survey nationally. We're very grateful for your feedback. Fourthly, news of a new internal patient access survey that we're going to start running to work out how we could improve things further. Fifthly, an introduction to our social prescribing worker, Leanne, who's there to help people who are affected by long-term health or social problems. Sixthly, a reminder about what to do if you think you have coronavirus symptoms and how to get tested. And finally, a reminder about national campaigns to raise awareness of possible symptoms of cancer, including lung, bowel, prostate, testicular and breast cancers. It's particularly important not to lose sight of other illnesses whilst we're still dealing with coronavirus. So, firstly, what is the surgery now doing and what are we still not doing? Well, we were concerned that those with existing health problems should not suffer as a result of the lockdown, and we've now started doing our long-term condition monitoring processes again and tried to improve upon these to streamline and make the most of every contact with the surgery. You'll find that this process may change the point in the year when you get invited for your reviews. It should, however, mean that those with multiple long-term health conditions have all their annual monitoring requirements dealt with in one process, preventing multiple repeat reviews throughout the year. We will be contacting people, usually by telephone, around the month of their birthday to invite them for their reviews. We're also now starting to offer B12 and depot contraceptive injections, which we weren't before. And where people were successfully managing on alternative medications, it may not be necessary to switch back to the injectable forms, but we'll review this on an individual basis. We're still not yet undertaking private medical examinations, for example HGVs, fostering, adoption medicals, and we're still placing low clinical priority on medical reports that don't require examination.
Where it's not possible to deliver appropriate care for you via telephone or video, we're inviting patients to attend our surgeries in person, as indeed we have throughout the pandemic. When you arrive, we're requesting that you wear a face mask or face covering. And within the surgery, our members of staff are also wearing face masks when they're in close or prolonged contact with each other or with the public. The purpose of this being to reduce the chance of spreading virus-carrying droplets during conversation or by accidentally coughing. When I went recently, I was a bit anxious. I didn't even know how to put a mask on, but I was told there's a little bit of wire at the top which you put across your nose, like that. And then I said, but it's steaming up my glasses. So then you just press it across your nose there, squeeze it in, not so you can't breathe, but then all the air then comes down and no steamed up glasses. Now, if you haven't got a mask, although you can get them easily in supermarkets, you must have one of these and just put your scarf around, lots around your nose, bring it down the other side, and there you are. So mask up, stay safe, and don't worry about going to the surgery.
When attending the surgery, we're asking people to wait for their appointment in their vehicle or outside in the fresh air. We have closed the waiting room to avoid bringing people into proximity. When people are booked into an appointment at the surgery, we are screening them and their contacts for coronavirus symptoms at the point of booking. We are also asking them to cancel their appointment if they develop suggestive symptoms before they attend. If you think you have symptoms, please consult the coronavirus page on the 111 website. We have a new chain barrier on the car park at Maylandsea. This is at the request of our local community to reduce antisocial behaviour in the car park during hours of closure. The presence of the barrier is advertised in the car park, but please ensure you don't park in the surgery car park after pharmacy closing, as you may get locked in.
So recently there's been a survey of GP patients conducted by Post, I believe. This is a national project, and once again we're delighted with the results of this. We seem to be doing extremely well, and we'd like to say thank you very much to our staff on that note, but also thank you very much to patients for your glowing feedback. For just a simple comparison, apparently 99% of our patients feel that it's easy to get through to the practice on the telephone, and that compares very favourably with 48% over mid-Essex CCG and 65% nationally. So well done us, and thank you very much to our patients for that feedback.
Hello. We're concerned to assess the impact of new ways of working and how easy our patients find it to access the care that they need. It's important that as we settle into this new normal way of doing things, that we're not disadvantaging any section of our population. We do recognise that technology has played a very important part in providing remote access to our services, and that some people are more confident or more comfortable with technology than others. To this end, we'll be trying to gather some feedback from you after you've contacted the surgery for consultation or support. We've prepared an anonymous feedback form on Google, and we'll be sending out a link to this feedback by SMS or email after your consultation. We can provide a paper copy for those of you who are unable to use these methods. If you could complete this feedback form, we can use it to identify any further improvements to our patient access processes within the restrictions being imposed on us due to the coronavirus pandemic. So please help us by filling in the form.
Hi, my name is Leanne Smith and I am the Social Prescriber for the Dengie PCN. The Dengie PCN is made up of the following surgeries: the Dengie Medical Partnership, Trinity Medical Practice, William Fisher Medical Centre and Burnham Surgery. So, what is social prescribing? Social prescribing is a non-medical, non-urgent referral option for patients that are registered at the already mentioned surgeries, who have one or more long-term conditions, who need support with their mental health, who are lonely and isolated, and who have complex social needs which affect their well-being. Patients over 18 can be referred to social prescribing for any of the following issues: benefits, finances and form filling, bereavement support, carer support, social activities and community support groups, once these are up and running again, counselling options, emotional wellbeing support, social isolation and loneliness, domestic abuse referrals, advocacy support, weight and lifestyle changes, and volunteering and training opportunities. So who can refer to a social prescriber? Anyone. Anyone can refer to a social prescriber, as well as self-referral, so that's referring yourself. If you are referring to the social prescriber on behalf of another individual, then you will need to have consent from the individual you are referring. To make a referral to myself, please ask or contact your GP surgery, or you can contact me direct on 07580 912 184, or you can email me on Leanne, Leanne, .smith33@nhs.net, Monday to Friday, 9 to 5. Thank you.
What to do if you develop coronavirus symptoms. Please take seriously, even at this stage, the possibility that you have COVID-19 if you start to develop symptoms of cough, fever, or loss of sense of smell or taste. I think we're all quite familiar with those symptoms by now. There may be other explanations, but the risk to the population and your contacts of not self-isolating if you do develop these symptoms outweighs the risk of being overly cautious. If you're not certain whether your symptoms represent coronavirus, then you may like to consult the coronavirus page on the 111 website, where you can also get advice on how to get tested and when you might need medical help. You can also get an isolation note for your employer from that website. If you're still not certain what to do, you should at this stage contact the surgery, either directly or through the Dr. Link app, so that we can advise you. You know that scene in the news that was concerned that the coronavirus pandemic has taken people's eye off other illnesses, And in particular, we'd like to remind you about the screening and symptom awareness campaigns for cancer. So clearly the screening programs are still up and running for cervical cancer, for bowel screening, and for breast. Furthermore, there are some websites which try and help people to decide whether the symptoms that they have might possibly be suggestive symptoms for cancer. In fact, there's a website that you might like to have a look at called Be Clear on Cancer. You can Google that. There are several notable symptoms which we make a particular point of for people. These are blood in your pee, noticing breast changes, so that's lumps or whatever, getting out of breath more easily, feeling new bloating for 3 weeks or more, new coughing for 3 weeks or more, blood in your poo, changes in your skin, having new heartburn for 3 weeks or more. Now, so that's a whole variety of symptoms. It's worth going and having a look at the website. But the point of this is not that all of these symptoms are due to cancer, because in actual fact, mostly these are not going to be caused by cancer, but that we'd prefer that you told us if you have these symptoms so that we can help you identify ways to be sure that these are not symptoms of cancer. So do go and have a look at the Be Clear on Cancer website. Please do take up the offer of cancer screening tests such as breast, colorectal, cervical cancer. Please do look out for your symptoms and bring them to our notice if you think you might have symptoms on that list. Thanks very much.